I am Dr. Bradshaw, and this video is intended for the use of my students in RAD 1611 and for review purposes for my students in RAD 2612. Today I'm working on the A to P lower cervical view. Now, first of all, this is a digital image that I have obtained from the clinic, and the first thing that I want to say is that I have the film flipped wrong, but that's because it was on the CD flipped wrong. Normally I would want this right marker on my right side, not over here on my left side. And so that's the first thing that I want to say, is that this image is at the wrong side, but we're going to use it anyway. Now, A to P lower cervical view is taken, of course, to look at the lower cervical spine, just like the name implies. On this digital area, you can see how far up the odontoid process is right here. You can, of course, see the atlas is above that. And so you see that the occiput is superimposing the atlas and the occiput. On a plain film that we use in the classroom, you usually can't see any of this at all. What you see is white. And that makes me then point out that the thing that you have to do on a plain film is go down and distinguish between C7 and T1 in order to know how many segments that you have, because you're really not sure whether you have only C1 and C2 not visible or if you have C1, C2, C3 not visible. So our first step is to go down and find C7 versus T1. How do we know that? The first TP that is pointing up is T1, the TP that is pointing down is C7, and then we would count it out: 7, 6, 5, 4, this is C3. Okay, so that's how we get started on that, and that's how we count it out. And normally on a plain film, again, we wouldn't be able to see that atlas and axis in that skull area because it would be too white in that area. Now, the central ray at this on this film is pointed or aimed at C4. There is cephalad tube tilt about 15 degrees. This film is taken A to P, red, P to A, and again, normally that would mean then that this right marker would be over here on my right side. But I can't switch this one now because it's already on the digital CD. So let's just look at structures on this film. If I get the mouse to show up and I start right here, again, this would be then the C7 spinous process. The C7 spinous process right here, and so of course all of this is the C7 vertebral body right here. Now we do see the uncinate process. Uncinate process fits into the uncinate fossa, which is the underside of C6 right here, and so the uncinate fossa and process create this joint, and the name of that joint is the joint of Luschka. When we look at spinuses and we count our way up, this would be, of course, the spinous of C6. This would be the spinous of 5. This would be the spinous of 4. This would be the spinous of 3. This would be the spinous of 2, but superimposing the body of C3. Now, why does that occur? And that's because you have a cervical lordosis that's going to put the spinous of C2 superimposing the body of C3. Right here, again, you have the uncinate process. Here you have the uncinate fossa, and right here is the joint of Luschka. And so that is a joint right there, and you can see it here, and you can see it here, and all the way down. We also can see on this film, we can see this increased white density right here, and that is your pedicle. The pedicle, in this case, of C5. And so the pedicle is right here. I can't get this mouse to stay on the screen, but it is the pedicle, that increased white density right here. And out to the side or lateral to the pedicle would be the articular pillar. Now, articular pillar, articular pillar, articular pillar, and you don't really see those through the zygapophyseal joint. And the reason that it's difficult to see that joint space, you see it a little bit on this digital, but it's still not a clear open space between two pillars, is because the facets are at about a 45-degree angle. And so you're not really able to look through the joint in this case, but these are all the articular pillars creating what is known as the articular column. We can see, of course, a little bit of that TP sticking out right there, a little bit of that TP sticking out right there, and so it's coming across right here, and that whole thing then is your transverse process. If we look here in this area, we see that it's darker, and I'm just moving the mouse intentionally from there to there, and I can move down and still be, and that is the airway. So at the level of C6 and C7, we are on the tracheal air shadow. Tracheal air shadow. Now, when I go down in this area, you see that the shape of the pedicles start to become more rounded, and in fact, when we get into the thoracic area, the pedicles are circular in shape. That's going to be important to you when you get to your X-ray full spine analysis class, because you're going to look at the shape of pedicles to help you determine the listing for Gonstead. And so the shape of the pedicle side to side, the one that is more rounded, or some people use the word fatter, wider. The one that is more rounded would be the side of body rotation. The one that is more elliptical or oblong would be the side of spinous rotation. So you'd be comparing side to side to determine which one is which. The transverse process of T1 goes all the way out to here. And you also then have this first rib coming in and articulating with this rib, and then it goes on in to articulate with the vertebral body. So that first rib is all of this and goes in this direction. Now the second rib, of course, would be this, coming across right here, and down here is the third rib coming across right here. But this structure that is coming straight in, right here's the top of it, right here's the medial aspect of it, that is going to be the clavicle. So the clavicle is right here. We have 1, 2, usually 3 ribs, either above or third rib superimposing. I have seen as many as 3 ribs above the clavicle with the 4th rib superimposing. So the posterior aspect of the rib is this, and of course it's articulating with the transverse process here, which would be the costotransverse joint, and then moving on in to articulate with the vertebral body here, which is called the costovertebral joint. We can see, of course, our vertebral body of T1. We can see the spinous process of T1. Spinous process of T2 is right here. And we can see pedicles of T2 right here and here. This rib that is coming in right here, of course, it's articulating with the transverse process, and again that's called the costotransverse joint, and then getting it to move into right here, this would be our costovertebral joint. Costovertebral joint. Now, we do see the angle of the mandible right here. Angle of the mandible is this, and the chin is actually going up in this direction, so the tip of the chin is here. The person usually has their head extended about 15 degrees. You can see part of their ear right here, and of course the mastoid's going to usually be right up here in this area as well. And so when you look for mastoid, you're looking for bubbly kind of bony tissue, whereas the angle of the mandible is a little bit more rounded, sharp, pointing, angled down. I believe that's everything that I wanted to discuss on this film. Have a good day.